Okay, thank you, Salman, for the nice introduction. So I have quite a challenge now, taking you back from the outer space back to not today, but actually history of cancer. So I start the talk by this couplet, by this poem from a famous cancer physician who died of cancer and who wrote this on his deathbed. Now, the reason I start this talk with a poem is because cancer, which I hope you will agree by the end of the talk, is a tragedy. And every tragedy is laced with so many different metaphors and so much poetry that it often eludes human understanding. So let's start the talk. How old is cancer? A lot of us think cancer is a fairly new disease. That's because we see a lot of people getting cancer now and not like 40, 50 years ago, or 200 years ago, or 2,000 years ago. Well, the first incidence of cancer is recorded 5,000 years ago in the books in ancient Egypt. There was a guy called Imhotep who was a vizier of the king of Egypt. He was a physician, he was an astrologer, he was a lot of different things. He wrote stories, he wrote books, but the most important book or writing he ever did in his life, the most important for us, is a case study, is a group of case studies of 48 different ailments. And for each one of them, he wrote exactly what are the symptoms, what are the procedures you can operate, whether it needs a surgery, certain kind of herb, certain kind of medicine, and what to expect from the therapy that you're providing. And in famous case number 45, he writes of a hard, cool, bulging mass under the breast. And in the therapy column, he wrote, there is none. That is the first written evidence of breast cancer or any kind of cancer in human history. Fast forward 2,000 years. Now I have to jump many thousand years at once. Hippocrates in ancient Greek also knew about cancer. And what he saw when he dissected a human body and he saw cancer, of course from a dead person, what he saw was swollen mass of muscle clutched by blood vessels. And what he saw really was the shape of a crab, and that's why he called it karkinos, or the Greek word for crab. Finally, 2,000 years after its first incidence, or first recorded incidence, the disease had a name. And as Susan Sontag says, the disease doesn't really exist unless you have given a name to it and identified it and accepted it as a disease. Another few hundred years later, the Greeks were making huge advances in hydraulics, and they wanted to quantify or put everything in terms of hydraulics. So this is how they classified human body and diseases. They said human body is made up of 4 fluids: the black fluid, the white, the yellow, and the red. And the body works fine if there is a good equilibrium of all the fluids. But too much of red fluid will cause inflammation. Too much of yellow fluid will cause jaundice. Too much of white fluid, which is the phlegm, will cause chest infections. And too much of black fluid, well, nobody really knew what the black fluid was. All they knew was too much of black fluid will eventually cause either cancer or all the mental disorders. Now, this is an interesting classification, but not very useful. The tragedy of this classification comes into being that since nobody really understands the black fluid, nothing can be done for it, so the conventional wisdom is do not touch cancer. You can try to remove it, and well, 2,000 years ago, the Greeks tried to remove the tumors. The patients died anyways, if not from the disease, from the pain of the surgery. Well, this conventional wisdom lasted almost 2,000 years till we reached the point of middle of 19th century, and then something remarkable happened in the field of medicine and surgery. In 1846, anesthesia became available. Now you can't think of surgeries being done before anesthesia. And after anesthesia came into being, so many surgeries were being done for all kinds of problems that doctors said, maybe we can fix, fix with surgery. So Dr. William Halsted was not the pioneer of radical mastectomy. He was not a pioneer, he didn't coin the term, but he was one of the major proponents. And the idea was this: if you take out a tumor from the body, and the patient survives a few months or something, if you take out more from the body, it's better. So you take out, especially from the breast cancer, you take out the tumor, you take out the muscle, you take out the lymph node, you take out half the chest. Such atrocious surgeries were done in a hope that eventually people will be cured. Well, most of them eventually died. And that gave rise to a new hypothesis given by Stephen Paget, who said, maybe maybe once you remove the tumor, and since it comes back again, it's not a new tumor, which Halsted believed. He said probably the cancer or the tumor is able to go into the bloodstream, travel through the bloodstream in the entire body, find a new fertile soil. Cancer as a seed, a new metaphor, that it can grow in a new fertile soil in a different organ and then kill the human. Now, this was a giant leap in the way you visualize cancer. Nobody had the idea that cancer could even travel within the body. This went on for a long, let's say 50 years or so. End of 19th century, another major thing happened, and that was X-rays were invented. In 1896 or 95, within a year, they were being used on the cancer to burn the cancers. So this is the second attempt of humans to deal with cancer. We can't cut it out, it comes back, let's burn it. Well, the next 50 years was the peak period of radiation therapy and also in the radioactivity studies with Marie Curie and others. So this really gained momentum. But it did not fix the problem. People are still dying of cancer. Then, 50 years later, came another major happening, and that was chemotherapy. This gentleman here, Yella Subbarao, was an Indian chemist working in Harvard who didn't get the tenure, went to a pharma company, but he was working pretty closely with a guy called Sidney Farber. Now, Sidney Farber was a doctor of the dead. He was a pathologist and the doctor of the dead children. He would take up dead children, dissect them, and try to figure out what really went wrong. Now, he was tired of looking at little kids dying. So he decided we have to do something, and he wanted to try out different compounds. He asked Yella, who was a long-time collaborator, and Yella synthesized the first antifolates and shipped them to Sidney Farber. And without thinking anything, Farber started injecting them. At that time, ALL, which is a childhood leukemia, was 100% fatal. He injected the children with these antifolates, and the kids started recovering. So well that after 4 or 5 months of injecting for antifolates, kids were as normal as they ever were, as if they never had a cancer. But eventually, 5, 6, 7 months, the kids would die again. This was the first grand hope in chemotherapy, that somehow chemotherapy or use of chemicals to kill cancer can work. Now, this raises a huge hope. But then, as I said, the reason we don't know that the cancer existed or was such widespread hundreds of years ago or even 50 years ago, and only now, view that only now, is cancer was a secret. If you had cancer, you never told anyone. If you had cancer, your doctor wouldn't tell you that you have cancer because it meant a death sentence. There was a taboo attached to cancer. And the journey of cancer coming from a basement to a street and then taking the center stage in the congresses and the lobbyists started with this guy called Sidney Farber, who converted from being a pathologist to a childhood leukemia doctor and went on to become a great advocate for cancer research, collecting money, starting a fund called the Jimmy Fund, one of his patients who eventually survived and lived up to 65 and died of a stroke in 1990s. Now, along with him, there was another important figure. Mary Lasker was an entrepreneur, a very successful entrepreneur in the post-Second World War era. And she married this guy called Albert Lasker, who was a great advertising mogul at that time. And they decided to go into philanthropy, and especially into diseases, human diseases. Eventually, Mary lost her husband, Albert, to cancer. Sidney Farber is known to have survived cancer, or at least had cancer or pre-cancer lesions in the last 10 or 15 years of his life. And there was a certain personal drive, and there was a professional drive, and there was a humanitarian drive in both of them, that they created these funds. They went to the street, collected money, campaigned, did a lot of lobbying, and eventually the hope was so high. And remember, this is the post-Second World War era. The nuclear bomb has been invented, technologies are going forward, you have the economy is booming, you have put a man on the space, you have put a man on the moon, everything is possible. We can cure cancer. There was this great hope. And then this came out in 1971. And this was funded by, of course, the Jimmy Fund and the Lasker Foundation and everybody else, saying, Mr. Nixon, America is turning 200 years old in 5 years. What a great gift it would be to cure cancer for the rest of the humanity. It's been 45 years, and we are not close to the cures. The history of cancer and humanity is a lesson in humility of not knowing your enemy and trying to fight it and throwing everything at it. And cancer has thrown everything back at us with vengeance. But if we start thinking, a major thing happened in 1960s and 70s at the same time when all these, the cancer had come out of basement taking center stage in the Congress. There were developments in molecular biology. The DNA double helix structure was known. 1970s was the first time we could actually open up the cell and sequence the cells. In the last 5 years, we have sequenced thousands and thousands of cells, including the cancer cells. And all these technologies and advances have led to a new understanding that cancer is not one disease. A breast cancer is not just a breast cancer. And let's say a leukemia is not just a leukemia, or a stomach cancer is not just a stomach cancer. There's much more to it. And the reality is, epidemiologically, cancer, each individual cancer is a set of hundreds and thousands of diseases with different changes, which if you look at the cellular level, it's a disease of a cell that's dividing without control. A cell that forgets to die or refuses to die and keeps multiplying itself. So it's a disease of a cell. And if it's a disease of a cell and not coming from outside, all the hopes of having a magic bullet like penicillin, go up in air, because it's us. The cancer is within us. It's our own making. The same thing that converts a small molecular machine called an embryo to a multicellular organism like you and me and the animals around is the same processes. So imagine something like a car where you have accelerators and brakes. And in the particular car, which is making more cars like itself, in one of the cars, the brakes get broken and the accelerators get jammed. Now these are the normal processes that are required to maintain a cell, and when they go wrong, that's cancer. Now from here, we've already had a lot of perspectives on different views of cancer. That I want to end it with a story from a very personal perspective. It's a story of a cancer patient, and I'm going to read it out from a book chapter, from this book that you see. This is a story of a woman called Germaine who got a very aggressive form of stomach cancer in 1999. She was treated with chemotherapy and some other drugs, and eventually it seemed her life could be extended. 2 years later, she relapsed. She went for a very new experimental drug, a molecular targeted drug to cure cancer, and it worked. She had another 1 or 2 years of healthy life. She created online communities of patients, of survivors who could talk to each other, who could find new medicines, who could discuss things among them. Eventually, she had a second relapse in 2004. She went to Boston, and this doctor, this guy, Siddharth Mukherjee, who wrote this book also, he's an oncologist, a medical doctor, also wrote a book on different aspects of cancer. And he was taking care of her towards the end when she went for a third experimental drug, and the drug didn't work. Now at this point of time, she's ready to die. She was a real fighter. She did everything she could. It's been 6 years. The life has been extended. And now she's on her deathbed. And this is how the doctor, Siddharth Mukherjee, remembers her and remembers their last meeting. When I recall that final conversation with Germaine, embarrassingly enough, the object seemed to stand out more vividly than the words. A hospital room with its sharp smell of disinfectant and hand soap, and steely, unflattering overhead light. A wooden side table on the wheels, piled with pills, books, newspaper clippings, nail polish, jewelry, postcards. Her room wallpapered with pictures of her beautiful house in Montgomery and her daughter holding some fruit picked from her garden, a standard issue plastic hospital pitcher filled with a bunch of sunflowers perched on the table by her side. Germaine, as I remember, was sitting by the bed, one leg dangling casually down, wearing her usual eccentric and arresting combination of clothes, some large and unusual pieces of jewelry. Her hair were carefully arranged. She looked formal, frozen, and perfect, like a photograph of somebody in the hospital waiting to die. She seemed content. She laughed and joked. She made wearing a nasogastric tube seem effortless and dignified. Only years later, in writing this book, could I finally put into words why that meeting left me so uneasy and humbled, why the gestures in that room seemed larger than life, why the objects seemed like symbols, why Germaine herself seemed like an actor playing a part. Nothing I realized was incidental. The characteristics of Germaine's personality that had once seemed spontaneous and impulsive were in fact calculated and almost reflexive responsive to her illness. Her clothes were loose and vivid because they were decoys against the growing outline of tumor in her abdomen. Her necklace was distractingly large so as to pull the attention away from her cancer. Her room was topsy-turvy with baubles and pictures, the hospital picture filled with flowers, the card stacked to the wall, because without them it would devolve into the cold anonymity of any other room in any other hospital. She had dangled her one leg at the precise post angle because the tumor had invaded the spine and begun to paralyze her other leg, making it impossible to sit any other way. Her casualness was studied, her jokes rehearsed. Her illness had tried to humiliate her. It had made her anonymous and seemingly humorless. It had sentenced her to an unsightly death in a freezing hospital room, thousands of miles away from home. This is happening in Boston while she was from south of United States. She had responded with a vengeance, moving to be always one step ahead, trying to outwit it. It was watching someone locked in a chess game. Every time Germaine's disease moved, imposing yet another terrifying constraint on her, she made an equally assertive move in return. The illness acted, she reacted. It was a morbid, hypnotic game, a game that had taken over her life. She dodged one blow only to be caught by another. She too was like Carol's Red Queen, stuck pedaling furiously just to keep still in one place. Germaine seemed that evening to have captured something essential about the struggle against cancer, that to keep pace with the malady, you need to keep inventing and reinventing, learning and unlearning strategies. Germaine fought cancer obsessively, cannily, desperately, fiercely, madly, brilliantly, and zealously, as if channeling all the fierce, inventive energy of the generations of men and women who had fought cancer in the past and would fight in the future. Her quest for the cure had taken her to strange and limitless journeys through the internet blogs and teaching hospitals, chemotherapy and clinical trials halfway across the country, through a landscape more desolate, desperate, and disquieting than she had ever imagined. She had deployed every morsel of her energy to the quest, mobilizing and remobilizing the last dregs of her courage, summoning her will and wit and imagination, until that final evening, she stared into the vault of her resourcefulness and resilience and found it empty. In that haunted last night, dangling onto her life by no more than a tenuous thread, summoning all her strength and dignity as she wheeled herself to the privacy of her bathroom, it was as if she had encapsulated the essence of a 4,000-year-old war. Thank you.